When it comes to cardiovascular care on the organizational level, MedAxiom, an ACC company, understands the challenges your program is facing. Welcome to MedAxiom Heart Talk, the podcast where thought leaders come together for one ultimate goal: to continually transform and optimize cardiovascular care for all. MedAxiom Heart Talk starts now.
I'm Cheryl Toth, host of MedAxiom Heart Talk. This special episode is the first of what we're calling our weekly COVID-19 briefings. As the CV services community deals with the pandemic in real time, we'll be bringing you answers and insights from physicians and administrators on the front lines. Each episode will be short and focus on three primary things: hot topics being discussed in the MedAxiom listserv and top-of-mind issues from our guests, updates from Capitol Hill or recent legislation that members should be aware of, and our guests' pick for the story of the week, an innovation or example of courageous leadership that they've seen within the last 7 days. For this first episode, we've invited a dynamic duo to join us. Calling in from Kingsport, Tennessee, we have cardiologist and physician executive Dr. Jerry Blackwell, president of MedAxiom. And from the front lines in Woodbridge, Illinois, in the Chicagoland area, we're joined by Cathie Biga, President and CEO of Cardiovascular Management of Illinois and a board member of MedAxiom and the American College of Cardiology's Board of Trustees. Jerry and Cathie, we know you are both extremely busy right now, so thank you so much for being here today.
Thank you. It's a pleasure. Thank you.
So Jerry, let's start with you. It's been another turbulent week. What are the two things on the top of your mind that MedAxiom members should be concerned about?
Well, thanks, Cheryl and Candace, for arranging these. They're so timely and I think so important for our organization. So there are 100 things that I could choose from, but I think that the two things that the community is really spending a lot of time talking about right now, at a broad level, of course, is the rapid pace of care transformation. This applies to every part of the organization, from the operational standpoint, from the financial standpoint, revenue cycle. The care transformation is occurring at an unprecedented pace for anybody that's in organized medicine, no matter how young or old. So our listservs are just dominated by different aspects of that care transformation. As far as a technical aspect, the second thing I will choose as my second one, the technical aspect that we're seeing is an intense interest in electronic visits, virtual visits, and how we transform or transition, perhaps is a better term in this situation, transition our prior care models into effective electronic care models. And that has, there are codes and issues related to reimbursement that have been on the books for a while that many, if not most organizations have had very little experience in, and certainly haven't been nimble in. And we've transitioned to those as well as telehealth. And so we have organizational folks spending a lot of time trying to teach each other how to do that most effectively for the benefit of the patient. So those would be my two sort of broad things that we're seeing on the listserv.
Well, and I would add to that, Jerry, that the organization has just done a wonderful job getting resources out to members in response to that, from webinars on the coding aspects and getting a telemedicine clinic up and going, to some of the resources that we have available to people. So if folks are wondering about that, those items are on the website. So thank you.
Yeah, it's almost overload, but we have to figure out how to get them to folks most efficiently or more efficiently than we are. But there's a wealth of information that we're trying to share. Thank you, Cheryl, for pointing that out.
Yeah, and Cathie, what would you say are the two top of mind issues? What are you seeing on the listserv? What are you hearing? Tell us from your perspective from the front lines there in Chicago.
Yeah, just to build on what Jerry said, and I think it is what makes MedAxiom so very strong, and with the coalition now with the ACC, I mean, that is our dynamic duo in reality. Jerry did sort of that broad strategic thing, and I think the listserv which is where all of us really go for the most up-to-date information. It is amazing to me how this village is helping each of us as we hit our surges solve the issues of the day. And I think the two big, maybe there's really three big issues of the day that we're seeing. One, of course, is how we set up our telehealth systems, and the confusion is just amazing to me because all the different terms and terminology, all the different things that we have been trying to sort out for a couple of years on telehealth is now just through a funnel within 24, 48 hours. It is just amazing to me. And the crowd that has put things together between Lori and Joel and Nicole, it is our true north. It is our source of truth. And Nicole has spent many an hour on the phone with myself and ACC to make sure that we get the very best answers out to our team. So I would really put telehealth, virtual calls at the very top of that. I think the second is staffing. How do we handle these surges in Chicago? We have McCormick Place up and running now. We have 500 beds down there. They plan to open up 2,000 more beds. So this competition for staffing is amazing and something that everybody needs to start to think about. What is your surge plan when somebody goes down? How are you going to handle that? So an echo department, a cath lab department, think of all those critical elements that we have. We went on blue and green teams. We used to call them A and B. Nobody wanted to be on the B team, but they don't mind the green team. So, blue and green teams will work. Just making sure that we protect our people. Our return to work policies, very, very important to make sure that we are protecting staff and families. We have now opened up hotel rooms for staff that don't want to go home to infect their families. So keeping our staff and our front line as safe as we can. PPE, of course, we can talk about forever. That's also been on the listserv. So those are probably the two, biggest areas and things that I think we need to continue to focus on and help each other. Whose idea? It doesn't really matter whose idea it is because it takes a village to do all this. So the amounts of different components that have been on the listserv have been very, very helpful. And the BOCN network has been amazing in making sure everybody has the no-touch exam in order to do your telehealth. We've been on office telehealth now since March 13th. We are now in both the hospital and our SNF facilities for about 9 or 10 days. So learning from each other on how to do that in these rapidly changing rural environment that we're in. And then finally, the care team. As we have said on other calls, we're never going to put this genie back in a bottle. So the fact that we now know how to do telehealth, and actually pretty good, how important our APPs are to us in that whole process, all very, very important as we unfold. So those, I think I gave you more than two, which I tend to do, but I think those are the key areas.
Good list. Yeah, well, it's a very good list. And I mean, there you are on the front lines. And you mentioned the staffing issues and all of these, a couple of different the blue and the green team and some of the other things. I'm going to move now us to the legislation and the news from Capitol Hill this week, which has really been the CARES Act has been something rolled out to address all what's happening. So, and it's a mix of support both for the healthcare system and economic stimulus. So what should practices and programs know about this? Obviously, they're aware that it came out. What should people be taking right now? What actions? And Cathie, since you mentioned some of the staffing issues, I'd like to have you answer that first. Where would you suggest administrators start?
We'll start on the MedAxiom listserv. I think Lori sent out the summary. It may have just been yesterday. To go to our webcast that we did this week on some of the legal stuff. Of course, like everything else, we realized 60 minutes was nothing to the complexity of this bill. So look at the facts, the FAQs on the CARE Act bill, as well as the Family First component. Our independent practices, obviously, enormous concerns. We are considered essential healthcare workers, but what does all that mean as it relates to the 2-week mandatory sick leave and all the different nuances? Probably the best thing I heard about these two bills is, oh my goodness, we have never seen a bill of this size before, and the rules aren't even out. The whole issue of, can I go and get a loan from my bank? And the banks are going, well, I don't know, who's really going to do the paper underneath this loan? So I think, in all honesty, There may be more questions than there are answers right now. I think our legal team did a great job this week, and I think we'll have more of that to just try to distill, not to give us the legalese, but to distill it down to exactly what do I need to do, whether I'm in an independent practice or an employed practice as it relates to these two bills. Is it really worth it for me to ask Medicare for a loan on my future payments, or is it better to just try to ride this out to see exactly what's going to happen with your cash flow? I honestly think there's probably a few more questions than there are answers right now, except to send us questions, because as we work with the ACC team, they have been having special meetings almost every other night in working with the advocacy group, going up to Washington, to the Hill, and to the AMA to try to get clarification. So don't hesitate to send us your questions. Know the bills are out there. Know that they have a good infrastructure for us, but I do think the rules have not all been written yet. I think the bill came out very quickly, and we need to really understand some of those rules. I don't know, Jerry, would you agree with that? It's really so complex.
Yeah, I don't think you can say any better than that, Cathie. I think that a few things that are striking. The first is, as you had commented, the rapidity with which this got rolled out in a very complex set of instructions. And I think, though, that a couple of things that feel good about this. One is there's no doubt that the intent of this is to provide relief to organizations that are providing this care and trying to figure out how practices, organizations can be helped. So I think that there's nobody that's confused that the intent is to help. Now, as Cathie subtly but importantly said, there's always concern regarding unintended consequences, because something that seems particularly obvious here as we're up to our knees, at least in alligators, can become the picture can change down the road. So, but I do believe that the feeling is that all of the regulatory efforts here are intended to aid organizations and physicians. So that feels very good. And as such, I think that there's reason to have confidence that there's going to be some latitude in how the rules are interpreted. But we can't be careless, and so we're gonna have to watch this all the time. I think Cathie's cautionary comment that we should be looking at the frequently asked questions on the listserv is crucial, because no one person has it all. It's the collective wisdom that's going to carry the day.
Yeah,
and let me just use telehealth as a really good example, because I swear it changes every 5 minutes. So as we see Cigna making their exceptions, Humana making their exceptions, Blue Cross making their exceptions, you really have to, this isn't an easy, let me give it to you in a half a page of bullet points. It really takes each state to look at it. Also, we are starting to see a lot of states doing executive orders, which carry broad guidelines. For instance, Illinois yesterday gave the medical malpractice waiver that we've been waiting for. It doesn't say that you can go out and be reckless, but it does say that during this public health event, that you will not be held, in quotes, responsible for medical malpractice unless it's woefully and wantonly malpractice components. And that's what really a lot of us were looking for, is we're postponing procedures, postponing imaging, canceling appointments, not being able to see our patients on video if they still have their flip phone from 2002, making sure that we're documenting that the patient's nuclear test or cardiac cath or angioplasty or vascular ultrasound was canceled after the COVID risks and benefits were explained to the patient. And this decision was rendered during the COVID pandemic. So very important that we document everything that we're doing towards this as it relates to our patients and their outcomes. So check your states as well, because it's not just federal stuff, it's also state stuff that's coming out.
Great. And let me just kind of close this section by saying this, the suggestion to put your questions on the listserv, that is so important, because it's such a great resource and way to connect and get answers. Right, to work together to get answers that maybe you can't get to as easily or quickly. So please, if you're not using the listserv, go ahead and throw a question out there and participate for members. The third section is we're going to close on a positive note. Let's hear each of you give us a story of the week. Tell us about an innovation or something courageous you've witnessed, something you did in the past week. Jerry, what's your story of the week?
Well, thanks again. What a great way to end. And mine's going to be very broad, but very important. I think that what has struck me over the past week, and actually you could extend this to the past month, but certainly the last week or so, is the remarkable resiliency and professionalism of the House of Medicine. Like never before, there has been a confluence of thought leaders, of practitioners, business people, regulatory folks that have worked together for the common good. And to be very specific about MedAxiom and our parent organization, American College of Cardiology, we've talked many times before about the value of the American College of Cardiology for science, education, quality, what the individual practitioner needs. And for those folks that are rolling up their sleeves and going into harm's way, literally, not figuratively, but literally, and dealing with science and quality issues on the front line, cardiovascular manifestations of this disease, internal medicine, pulmonary critical care aspects of this. The science is moving incredibly fast from around the world, and there is no doubt that the source of truth for that resides in the American College of Cardiology and people that have focused and funneled their energy in science, quality, and education for this. It's just been remarkable. But it's been no less remarkable than what has happened on the health affairs and advocacy side. Sam Jones, who runs that committee, Thad Waits before, and so many folks have contributed from around the country to really help on the legislative, the regulatory side, and to move the needle. So the arm in arm of the science, education, and quality with advocacy and legislative aspects of this have truly been important to me to see as a practitioner. And MedAxiom is positioned immediately between those two and arm in arm with both to help with the organizational performance improvement. So, several colloquialisms come to mind. It takes a village. We're seeing that. As my colleague Ed Fry had mentioned in a previous discussion, it's been heartwarming. There's no discussion about physician compensation in this. What folks want to know is how can we help individual patients and, more importantly, society. There's a cadre of physicians. Cathie is leading a group in Chicago that are in the eye of the storm right now. I'm in a more rural location in Northeast Tennessee, Southwest Virginia, where it's on the horizon and we have a touch of it, but we have nothing like that. Yet we're learning and we're helping each other. So it does take a village, the physician side, the non-physician side. And then I'll just close with, what has been heartwarming about that whole thing is just the ingenuity, resilience of the American spirit, the professionalism of the House of Medicine, and just this notion of the shelter of each other. We are when the final horn goes off, we're in the shelter of each other. To the extent that we take care of each other through this, we're all going to be better. I've seen that more than I've seen in the previous 30 years of medicine, and that's the truth.
That was so beautifully put, Jerry. Thank you. And Cathie, how about you? What's your story of the week that you'd like to share? Let's hear from you.
Thank you so much. And, I don't think I could really improve on Jerry's comments. It's sort of like trying to follow Ed Fry when he gives an eloquent statement on these types of things. But I think never, God works in mysterious ways. And I think the fact that ACC and MedAxiom are together during this, once in a century, hopefully never to be experienced again, pandemic, that combination of science and operations has just been incredible. And, from Tom Maddox, who's doing the science and quality, turning things around in the matter of days and weeks as opposed to years, watching the silos just completely come down everywhere. Working with our partnering hospitals as we have incredible surges in some of our residential facilities and jails and such like that, everybody kind of coming together to take care of patients. But I'll close on maybe our village as it came together. So the heroes work here that is now in front of every one of our hospitals. as our nurses and our physicians leave their homes every day, coming to work, not knowing that what they're going to be exposed to, knowing full well that they probably will be exposed to something, and yet marching in those front lines is just awe-inspiring. It is amazing to watch it day in and day out. Our cardiologists have identified this. Obviously, we're not on the front lines as much as our pulmonary colleagues are, but as our ICUs are now exploded and we've created new ICUs, our ventilator count doubled overnight, those types of things. The physicians, God bless their souls, decided to host pizza parties for the hospital staff. Now, this whole week, our hospital has been like a dead zone. You don't see anybody walking anywhere. Everybody is isolated in their units, masked and gowned to the hilt. And yet this pizza party yesterday was so rewarding to see staff actually come down. We decided to actually have it in the cafeteria, socially distanced, of course, masked and gloved, of course. But watching people just take some gooey, cheesy pizza was just really refreshing. And one of the staff said, it's so good to see there's actually still people in my hospital. I was worried about that. So I think we can't forget our humanness, and to make sure that we are all treating each other well, making sure that we are getting enough rest, because this is a marathon. This is not a sprint. And it's tough. It's really, really tough. So I think the other thing that is so refreshing is we are starting to talk about the number of patients we have discharged. So we have that you're winning this battle in many zones. We are winning by getting our patients home and back to their families. So I think we need to not forget that as well too, that because of the care we're giving these patients, they are able to get home to their families. And with that, hopefully, Godspeed to everyone. Keep your masks handy. Please be careful. And thank you for MedAxiom for all that you do for us in the field.
It feels so good to end
Thanks,
on that, on that good note. So Cathie Biga, Jerry Blackwell, thank you both so much for being here on our first episode of this weekly COVID briefing by MedAxiom Heart Talk. Thank you so much.
Thanks, guys. Have a nice day.
Thank you.
The COVID-19 situation is changing at a rapid pace. To respond to member needs, MedAxiom has launched a COVID-19 webinar series and an online resource page focused on organizational information and support. Topics include practical approaches to an unprecedented pandemic, setting up telehealth in your office, operationalizing telehealth visits and virtual services, and more. MedAxiom's COVID-19 webinar series recordings are available on this resource page at medaxiom.com/COVID-19. Plus, you'll find links to federal and other agency guidance. All of this on our COVID-19 resource page at medaxiom.com/COVID-19.